Okay. All right. Well, welcome everyone to the Region 2 Planning and Policy Council meeting, the first one of fiscal year 22. My name is Kirby Fye. I'm with the department. Just a few reminders before we go ahead and get started. In order to keep everyone safe, especially now with this new variant going around, the councils all decided that it was best to continue to meet virtually. With that being said, we are going to meet per the Open Meetings Act. So this meeting will be recorded and it will be posted to the department website within the next day or two. Please keep your phones and or computers muted if you're not speaking, just to prevent any feedback from coming through. And please also state your name before you present or ask any questions. It's helpful when capturing the minutes. I'm going to go ahead and go through attendance, and then I'll hand it over to you, Mary, now.
Thank you.
You're welcome. Like I said, this is Kirby Fye with the department. We have Heather Vestal, Avis Easley with the department, Ben Harrington, Jan Cagle, Candace Allen, Karen Broadnax, Allie Cohn, Daniel Ellis, Allison, is it Dush? Did I pronounce that right?
Yes, that was really good.
I tried. Aaron Red, Jeannie Steele-Mack, Jill Cordell, Chris Roberts, Kristen Veloff with the department, Cooper Urkel Bryant, Kurt Hipple with the department, Marcia Swanson, Mary Nell Osborne, Michelle Trofeter. Hold on, I just lost my. Pamela Laskowak. I hope I pronounced that right.
Laskoyak, it's good.
Tammy Wilson and Zach Blair with the department. Have I missed anyone? All right, Mary Nell.
Okay. Well, again, welcome everyone. It's good to be with you. I want to give a special shout out to Chris Roberts. She's secretary of this committee, and for her hard work in keeping track of all the membership, the applications, but also to congratulate her because she's a new grandma. Yay!
Yay!
Congratulations.
Yay! So anybody who's not attended this meeting before, we're welcoming you. We've certainly gotten, I think in the past week or so, I've heard from lots of new members and folks who want to participate, and that's what's going to make the difference in our work for next year. I kind of see it as a new year for us because it's a new fiscal year with the state, but it's also the time that we are going to be gearing back up to identify the needs of our communities, behavioral health wise, and what we're concerned about in the state. So here's to a new year. This region was really active in proposing both legislative proposals as well as identifying community needs last year, and I'm really proud to be, I would say, leading, but basically I feel like an organizer, and that I think is my gift here to the committee. So thank you for your participation and your hard work. If you would like to be a voting member, you need to fill out an application for us. All you need to do to get that is to let us know after the meeting, send me an email, or let someone know, and we can send you an application. It is then sent on to the state and to Chris so that we can all keep track of that. And that will enable you to vote. You can participate without being a voting member. We certainly want to do more outreach with consumers and have their input and involvement. And some of us are both of those professional working folk and agencies and consumers. So that's a wonderful thing. But that's one of the questions in the application, so that we can keep track of our membership and the types of folks that we are engaging. I want to give a really big shout out. I don't know if Amy Olson is on here, but she sent me a huge list of people that she's going to engage in the Children's Committee work from all over the region, over in Roane County and Anderson and all that area. So I really feel like we've gotten good involvement. And I want to shout out to Amy for her leadership with that committee. One thing that I included in the agenda today that I want to ask everybody, you can do it within your committee work or you can do it as an individual. The state is asking for our input. The commission, TDMH, is asking for our input for the joint annual report. And they want key accomplishments achieved over the past fiscal year, challenges we faced over the past fiscal year, and our plans for the future. I laugh at that also because every time we plan for this pandemic being open, it presents us with new challenges. So I know that everyone here has met those challenges and will continue to do so. But if you could get that information perhaps back to me in an email format, that would be great. And I think the deadline, Kirby, do I know the deadline of that?
Can you repeat that? You cut out.
I'm sorry, it was the ask for the joint annual report.
September 17th.
September 17th. So let's say that after Labor Day, what about that? Is that plenty of time? Right there, whenever that is. I'm looking at my calendar. If folks could get that information to me by the week of the 7th of September, that'd be great. Okay. All right. Now I did send out the minutes from May 12th, our last meeting. I think that's our first order of business, is to review those and have any corrections. Okay. If I'm not hearing any corrections for the minutes, do we have a motion to approve the minutes?
So moved. Oh, there you go. Or Ben moved and I can second. This is Daniel.
Either way.
Thank you, Daniel. Thank you, Ben. All right, let's move on. Kirby, I believe you're going to give us an update.
Yes, let me pull this up. Just a few updates since we last met. One of them was already brought up, and that is the joint annual report. We need your region's key accomplishments achieved and challenges faced for fiscal year 21. So that's July 1, 20 through June 30th, 21, as well as your region's future plans. Each year, a joint annual report is produced and delivered to the governor and state legislature to highlight accomplishments, challenges, and plans for the future. The report is a collaborative effort between our department, the regional councils, and the statewide council. It sounds like you already have a plan in place to put this together. It's due to me via email no later than September 17th. Year 3, fiscal year 22 of the 3-year plan is in progress. Regional councils will have an opportunity to review within the coming weeks. Development of the fiscal year 22 mental health block grant is also underway. Statewide and regional councils will have an opportunity to review that document as well. The 2021 legislative summary is complete and has been posted to the department website. I've included the link for where you can access this, which I'll send to Chris to include in the minutes. I'm going to let Zach go into more detail about that later in the meeting. And lastly, the department is releasing a new certification for peer support specialists designed specifically for young adults with lived experience of mental health and/or substance use challenges. The Certified Young Adult Peer Support Specialist program is tailored to young adults in both design and language with a target age range of 18 to 30 and a requirement of 1 year in recovery. The program includes a 1-week, 40-hour training session covering topics including responsibilities and expectations of the program, strategic sharing, youth empowerment, positive youth development, the ladder of youth voice, and trauma-informed care. Through this training, specialists will gain the knowledge needed to provide youth and young adult-friendly peer support services to individuals under the age of 30. Peers certified through the program are also required to complete service hours and continuing education to maintain their certification. This program joins the department's current offerings in peer certification, the Certified Peer Recovery Specialist and the Certified Family Support Specialist. I've also included a link in here where you can gain more information and hopefully get any questions answered that you might have about this program. And that's what I have.
Thank you. Any questions about that stuff? We're excited about that young adult peer support training. I think that'll be valuable. Zach, I believe you're next on the agenda.
Well, good morning, Madam Chair. How are you today?
Good morning. I'm good.
Well, thank you. Always have fond memories of Region 2 whenever I get together. The first time I got to attend back when we could meet in person, y'all threw me a little birthday party, and I always remember that and appreciate my warm welcome to Region 2. Hopefully I'll be visiting a little bit more during football season, but football season always scares me as a Tennessee fan now, so sure it won't be any different this year, unfortunately. Hope everyone's doing well. And first thing I'd like to do is introduce a new member of our team. Kristen Veloff with the department has joined us. She joined us back in June. And the first thing that I've been doing with all the regions is trying to introduce Kristen to everyone. Kristen, I'm not seeing her on here. I know she's on the call, but I can't see her video pop up. So hopefully you all are seeing her.
Zach, can you see me now?
I can't, but hopefully everyone else is. I don't know why mine's not popping up the active person, but that's okay. Kristen is someone that we're very excited to have on our team. Kristen just came from the Tennessee Board of Regents, where she was Assistant Vice Chancellor over Government Relations. Her and I actually, before that, were both on the DCS legislative team. So we've worked together for quite a while and through several sessions, and I'm thrilled to have her as another valued member of our team here at Mental Health and Substance Abuse Services. Kristen, I will let you say hello to Region 2.
Hello, everyone, and good morning. I'm so excited to be here, and please let me know how I can help. I'm basically here to make Zach look good and help him in any way I can. So I appreciate everybody, and just let me know what you need from me, and I look forward to working with each of you and getting to know you.
Welcome.
Thank
you. So where are you located?
I'm currently located in Nashville in the kind of Germantown area right outside downtown.
Okay. All right. Well, welcome.
So as you can see from my video, if Kristen's job is to make me look good, she's in for a huge challenge for a long time, both from that perspective and from the work that I do. So, but that's why we brought her on, because she's really good at what she does. And so I'm excited to have her, and I appreciate her willingness to try to make me look good. So we're, like I said, extremely thrilled that Kristen's joined us. I'm going to share my screen so you can see the legislative summary. I will apologize to the folks that were on the statewide meeting yesterday, because you've been through this, and I will do my best to be as quick and efficient as possible, and happy to answer any questions about any bills that I've highlighted or any bills on the summary that you've seen that you may be interested in discussing. But you'll see I've highlighted just a few. Obviously, if we went over every single bill, we'd be here for a long time. And I know someone was eating lunch and would probably appreciate the opportunity to, other people probably would like to do that before the day's over as well. I'll also apologize. I was very heartened to hear some dogs barking in the background when we started our call. I have a 70-pound German Shepherd door alarm that likes to do the same during my meetings. So I will apologize for him if he starts, and will do my best to settle him down as quickly as I can. So starting here on page 1, House Joint Resolution 175, you will see is very fitting that it is at the top of this legislative summary. For those that have worked in the criminal justice field and have worked in recovery courts and other efforts that our department has undertaken with our partnership throughout the community. Ellen Abbott was a huge person that impacted those pieces of work that we do. And we were very sad to lose her at the beginning of this year. And we were excited and grateful that the legislature honored her with a joint resolution. So you can see that, read the text, and would encourage anybody that knew Ellen or worked with her to take a look at this tribute to her. And we're very grateful that it's there. Moving on to the next bill on page 1, Senate Bill 753, House Bill 81. This was an administration bill that was proposed by our department. Does several things, but the last 2 bullet points are something that I think the councils are interested in. As you know, or many of you may not know, the regional councils are actually not enumerated in state law. And this bill placed the regional councils in state law for the first time in order to clarify what their goals and requirements are for membership for the regional councils. And it simply says that the councils, while the statewide council is required to have a certain membership composition, the ask is that the regional councils are striving to include a majority of service recipients, former service recipients, and service recipient family members. So during the statewide call yesterday, many council chairs mentioned their efforts to recruit service recipients and clients that are involved in the system. And I know Mary Nell has already done that today. So we appreciate that effort as y'all continue to try to be mindful of that goal and strive for that effort in your membership. The other part of the bill that was really important, and I think the councils would be interested to know, there was some statutory confusion around licensed alcohol and drug abuse counselors when the original large telehealth bill passed back during a special session during 2020. So this bill just clarified and made it very, very sure in statute that licensed alcohol and drug abuse counselors are allowed to practice and provide their services via telehealth or telemedicine. So wanted to make sure that that clarity was there so there was no confusion about the ability to do that. Moving on to page 2, the very last bill on this page, Senate Bill 739, House Bill 73, was a governor's initiative to enact the K-12 Mental Health Trust Fund. There was a lot of media coverage and talk about this effort. $250 million, so $250 million was invested from this year of non-recurring funds to be able to provide prevention, intervention services for mental health needs for K-12 students. And we are extremely grateful and excited about this program as it represents a very, very large investment. And this bill, while it didn't create the funding or appropriate the funding for the program, it did set in place the parameters and how the accounts and all those are supposed to operate. So the initial deposit, 10% of that goes into account that can be used for services immediately, and then 225 million is deposited as the corpus of a trust that can grow on an annual basis, and the proceeds from the interest and investment growth from that trust can then be transferred to that other account to be used and continually be used for services. So it was a very creative way for the state in a year where there was an abundance of non-recurring funding and a lack of abundance in recurring funding to be able to turn that non-recurring into recurring funding so that there's a consistent funding stream for that ability that is there and available on an annual basis for us to use. So really excited about that. And you will be hearing more and more about that in the coming months and the coming years as we get an idea of how much that will generate and what services are needed throughout the state for students. Moving on to page 4, at the very top of this page, Senate Bill 207, House Bill 215 is a bill that is really related to recovery residences and drug treatment programs. Specifically for those that are in the business of providing recovery residences, there are some requirements in there to become certified under a national standards organization if the recovery residence isn't receiving funding from a state or federal government. So for those that are in that realm, we really encourage folks to take a look at that to make sure that they understand the requirements and the provisions related to recovery residences to be sure that referrals can continue to come from a variety of sources. But like I said, the ones that are state or federally funded are not required to come up under that certification in the same way. So this is not licensure, but it is a requirement for some type of national standards to be applicable to those recovery residences. Senate Bill 558, House Bill 1132, the second to the last bill, establishes the Opioid Abatement Council. And some of you have heard more and more about this in the last couple of weeks as we are hopeful that we are very quickly moving towards settlements with opioid manufacturers. We are working with the Attorney General's office. And this bill was passed to make sure there was an orderly and structured way to invest those funds and to divide those funds between local governments and state government to make sure that that money is used for the purpose of opioid abatement in Tennessee. So you will hear more about that. This is an independent council, but it is administratively attached to the department, and various individuals have appointing authority and will make appointments to that board, and that board will then hire staff to do the work that is set out in the law. So another something that's very exciting is we will see funds begin to flow in for services on substance use disorder for those that have been impacted by the opioid pandemic. The next bill, Senate Bill 118, House Bill 490. This bill creates the Medical Cannabis Commission, does not legalize medical cannabis, but requires this commission to be formed and to provide a plan to the legislature in the event that cannabis is descheduled from Schedule 1 on the federal level. It also raised the limit on some products that contain THC for those with certain health conditions if they meet requirements. So there was a little bit of a change on the THC limit again for certain individuals who have certain health problems, but it was a kind of a limited carve out for that purpose. And the plan for a potential medical cannabis program will come later after the commission is formed and after individuals are able to meet and make that plan to the legislature. Moving on to page 5, Senate Bill 1265, House Bill 508 was really an effort to respond to some of the issues that came out of the COVID-19 pandemic related to graduate students and other students that are in medical training programs and allow them to provide services via telehealth so that they could obtain their clinical hours. Obviously, with the pandemic, it was difficult for some students and graduates that are pre-licensed to be able to obtain the appropriate supervised hours to get their license, and this bill was passed to help alleviate that concern. Moving on to page 8, The two bills at the top of this page are both known as sunset laws. Every governmental entity in Tennessee is subject to review under the Tennessee Governmental Review Act by the legislature. And each department, governmental entity is actually scheduled to expire for at certain periodic time frames based on the state law. And this was our turn to go before the legislature and continue to justify our existence and the good work that we do. And we're very pleased that the legislature decided to extend both the department and the Planning and Policy Council for another 4 years. So once 2024 hits, we anticipate we will go through this process once again. And we were very grateful to the help of the regional councils, the statewide council, and everyone that participated in making sure that there was a favorable outcome there as we went through that review process. The last bill on this page, Senate Bill 773, House Bill 779. This was a bill that was kind of left in the hopper for departments and other agencies that needed to make some of the executive order provisions from the COVID pandemic permanent. And most of this bill really pertains to the Department of Labor and Workforce Development. But there was one portion of the bill that we asked for related to transportation of psychiatric patients who are going through the involuntary hospitalization process. And it just simply allows a transportation agent to be able to accept an electronic copy of a certificate need when they transport a patient. So as you know, with more and more evaluations occurring in either teleaudio or other visual virtual means, sometimes a paper copy of that certificate wasn't necessarily generated. So it simply updated the state law to allow an electronic copy to be sufficient for that purpose. Moving on to page 10, and these are the last bills that I will cover on my list, but these were two very important and pretty comprehensive bills that passed during the session. Senate Bill 767, House Bill 784, and then Senate Bill 768, House Bill 785. These bills were the governor's criminal justice reform bills and were probably the top priority of his legislative agenda for this year. The first bill deals with community-based alternatives to incarceration. So looking at different ways to divert folks from incarceration to services and to supervision if that's appropriate for the potential offender. And then Senate Bill 768, House Bill 785 is really related to reentry and making sure there are provisions and plans for those who are about to be released or are imminently about to be released from incarceration. So two really important bills. I tell everybody I'm certainly not an expert in the criminal justice realm, and I don't have as much knowledge as I would like to, but these are really important pieces of legislation, and if you're involved in the criminal justice programs throughout the state, might be very interested to know more about those in this legislative summary. That is all that I plan to cover on this document. Obviously, this is posted on our website. Each bill's got a link to the public chapter in its final and effective version. So happy to answer any questions or discuss anything else on the list that you saw that you might be interested in.
This is Pam Listyak from All for Knox in Knoxville. How do we get somebody who could talk to us about House Bill 0215?
Will you show me what page that's on?
It's the one it's not licensure, you said, but it is concerning like sober living houses.
Sure.
It's on page 2. There it is.
Yes, so Senate Bill 207, House Bill 215. The bill itself is basically requiring recovery residences that are not funded by the department or by another state agency or by the federal government to be credentialed by a national organization that creates best practices. So there are a few out there. You have the National Association of Recovery Residences. You have Oxford House. Those are just the two that come to mind. I know there are more, but the idea is that is to look at trying to make sure that they are providing a living environment that conforms to some national standards. What I will say is that credentialing is not required. It's only required if you want to receive referrals from licensed treatment facilities, the court, and some other sources. But the certification is not required if those referrals are not something that you're interested in receiving. The other thing that I will tell you is that the effective date of this bill is pushed out a little bit. Let me go look at the actual effective date to ensure that any recovery residences that are interested in that type of membership have the amount of time to be able to comply with that. Let me see what the effective date is. Sorry, it's taking just a little while to load. So July 1 of 2022. So there are a few months between when the bill passed and when the provisions of the bill come into effect.
Who could be a good resource to connect the people to know what the requirements for that credential is?
So I would probably recommend that. That's a really good question. So it's a bit of a tricky situation because we can't provide legal advice for compliance. I can give you the information that I know and can read what it says. But as far as somebody that would be an expert in compliance, that would be a little bit difficult for me to know who might be the best person for that. Obviously, I think Nehru Gobin in our department, our director of housing and homelessness services, would be could be a resource there, and maybe some of the organizations that are here in Tennessee that deal in that may be helpful. But just for your background, the way it's defined in the state law that is passed, organization means any nationally recognized recovery resident standards organizations, any affiliate of a nationally recognized recovery resident standards organization, or a grantee of any state or federal department of agency. So those all meet the requirements, and the department is required to maintain a list of the organizations and the requirements that are listed in the bill. So if a recovery residence is not recognized or certified, there is a requirement for a posting of a sign. And then the other requirement is that a referring, like the Department of Correction, a referring judge, or a referring treatment center has to refer to recovery residences that are certified by an organization. Is that helpful?
It is. So you would recommend us to talk to somebody like NAR or Oxford House, and they should know, right?
I would certainly hope so, since this is something that they would that hopefully they were paying attention to during the legislative session. I hope the bill is clear enough where the requirements are easily enumerated in there. But yeah, I would think that the folks that are familiar with recovery residences and those that participated in this bill would be knowledgeable about the requirements there.
Pamela, Jan Cagle just put in the chat, Mary Linden Salter with Tatus.
Thank you. Yes, thank you.
Yeah.
Yes, I should have mentioned that right off the bat. I think they would be a very, very good resource too, because obviously this impacts a lot of their providers and their the folks that they support.
Mhm.
Thank you so much.
Thank you. Good questions.
Zach, I've got two
Hey,
questions.
Go, Ben.
Yeah, go ahead.
Okay, Zach, two questions. First of all, the reentry bill.
Yes.
Do you know the particular details on that in terms of what is being reconnected to persons prior to release from jail or prison?
Ben, unfortunately, I do not. This was not one that we, other than reviewing for impact to things to the department, we did not participate a great deal in this bill. And so I apologize. I don't have, and again, it's an 11-page bill. I don't have a lot of details on the individual provisions related specifically to the reentry, other than us reviewing the things that were impactful to the department itself.
Okay, so because we don't know details, we don't know anything about like reconnecting Social Security or Medicaid to the person reentering?
Unfortunately not. That's not something that I'm familiar with. I'm sorry.
Okay, all right, thank you. We'll certainly prepare a amendment to the bill to allow those things. Second thing is, I know the AOT bill sponsored by Senator Massey did not pass, but I wanted to weigh in and just ask what the department's official position was on establishing AOT.
Can you,
So our
can you
official
wait,
position-
go ahead and say,
on that bill is that we had a fiscal impact to the bill. So there was it was fiscally flagged due to funding that would have to be provided in order to provide the services.
can you say out what AOT stands for?
AOT stands for Assertive Outpatient Treatment.
Yes.
Literally is court-ordered treatment for an individual against their will. And we've had rather poor experience with the pilot project here in Knoxville when we had it. And so a number of stakeholder organizations were opposed to it. But Zach, you're saying because of the fiscal impact, it was flagged and the department was not supportive?
So there was not a philosophical position. It was a fiscal position. And that was flagged by the administration for fiscal purposes.
Okay.
This is Candace. We're the ones that implemented the pilot AOT at McNabb and the PACT program, because you really need that kind of 24/7 intensive, and there's not very many PACTs. There's only 2 in the state because they're not funded. What the main obstacle for that was the fact that the families did not have any access to any kind of legal representation as far as reimbursement. Their loved ones could be afforded a lawyer, but they did not. So there were several families that tried to do this and get some help in that way, but they were unable to access it because they didn't have any money, bottom line, to go to court. So that was, and I don't know, and I didn't read that bill. Was that part of the proposal to allow dollars in a fiscal note to have families be able to afford that, or do you know?
So the bill as proposed would have required legal representation for the client. And so I know that was part of the legislation, and the bill itself did not call for funding, but if it would have passed, it would have been unfunded without money going into the budget. So because the bill did not pass, it never got to the point in the finance committee where the members of the committee tried to reconcile the note and the budget.
Okay, thank you.
Yes, ma'am.
Candace, just so you know, the fiscal note on the bill has been sort of a roller coaster of estimates over the last several times it's been proposed. And so the bill sponsors have continued to try to, let's just say, manipulate the fiscal note downward a lot so that it looks more palatable to their legislative colleagues. So that raises a huge red flag in a lot of stakeholders' eyes, because how do you start with a $17 million fiscal note and then all of a sudden it's only $700,000? So,
and I will clarify that point too. The reason why that fiscal note went down in a significant way, the bill was limited to populations and counties where there were recovery courts. And because there are 12 counties that have that, it wasn't a statewide program. Often legislators will limit the impact of the bill for the purpose of reducing the cost. I will say I don't think there was any underhanded efforts going on in that particular instance because it was limited to counties that had a specific program.
For recovery courts?
Yes.
Okay.
Hey, Zach, this is Kurt. I think it was a mental health court, right? It was a specific
Yes,
type.
yes, mental health court. Sorry, it's a specific mental health recovery court. And
Okay.
there are only 12 counties that have a specific mental health court as part of their recovery court profile.
Thank you.
Daniel, I think you wanted to say something.
I actually didn't have something specifically to say on this one.
Okay.
I do know that there are Tennessee Faith and Justice Alliance of the Tennessee Supreme Court and the Pro Bono Project of Legal Aid of East Tennessee, and then other legal organizations can try to find attorneys to support petitioners, but that would be difficult and very individually based. But I actually didn't have anything to say on this one. Thank you for the opportunity, Joe.
Okay, I thought I heard you earlier. Are there any other questions? Sarah, you have your hand up? Sarah, Canada?
Yeah, I did. I had a question. The education bill, as a special needs mom with a child who has several mental health diagnoses, who is about to go into kindergarten, how will the K-12 bill help her in school?
Trust fund.
So fortunately, I will say that there are already services and things available for students outside of this bill. So even while this program is getting ramped up, there are other opportunities for engagement for students that are experiencing mental health issues in the state. Of course, we have the school-based behavioral health liaisons. There's at least one in every county throughout the state that can help connect students and families to resources in the community. And additionally, the legislature has funded the behavioral health safety net for children. We have had the adult safety net for a long time, but the children's safety net provides outpatient services for children who don't qualify elsewhere for services either through private insurance or the TennCare program. Now, as far as the K-12 Mental Health Trust Fund goes, the first thing that we will do as a department is conduct a needs assessment throughout the state and make sure that we are aware of what individual regions, districts, even down to the county and city level potentially may need for their community, and then begin deploying funds based on the needs that are identified through that needs assessment process. So that unfortunately is going to take a little bit of time to complete, and we anticipate doing that as quickly and as efficiently as possible. But the needs assessment will really drive and guide the funding and the programs that are funded by the money that comes into the trust fund.
So Sarah, that's a great question. I really want to commend you for speaking up as a mom. And I know that you're a good mom. We have a children's committee that you can participate in, and we would love to have your voice in that as well with Amy. So if you want to be involved, that's a good way.
If you can just get the information to Jill or Cheryl, they can get it to me.
I will. The other thing
And
I wanted
I would definitely be a part of that committee, yes.
Wonderful. The thing I was clarifying is I think that this bill is finding a way to pay for the things we want to do for the long haul, investing a bunch of money and then using the interest off of that big pot of money to pay for the things that we want to do. So thank you. All right. Any other questions or comments? Marcia, do you have your hand up? Okay.
I want to know about my daughter doesn't have insurance. She lives in Knoxville. What would I have to do to get her an idea to where to go and get help? Because I know they passed that with mental health way back, and I forget the name of the program because I forget things. I don't remember them.
So it's safety net or seeing a case manager at any of the facilities or I guess medical offices as well.
She has no insurance and she's bipolar.
Yeah, so if she goes to a mental health facility and makes that appointment, then she can complete paperwork to see if she qualifies, which sounds like she should, for safety net.
All she does is she's a server.
Yeah.
You know, they don't
right. And that's absolutely very possible. So I can direct you to that and you can share that information with her after this. How about that? Yeah.
Okay, thank you. Thank you.
Good. Wonderful. And then you can share that information with everybody else that has that same question, because we want to get people in services and in treatment.
I do want to know about that anyways, because I know a lot of others that could use it.
Sure. All right.
Hey, Mary, now,
where are we?
If we at the department can be any help on that, just let us know. Yeah, I think you're on the right track.
Thank you.
Safety net might be a good option, and some other things. So thanks.
Yeah.
One more thing. Do you have like flyers or things that are made that I can give to people? Because sometimes people don't want to discuss with me, but they would want to know about getting something done.
I'll be happy to post a link to the flyer in the chat in just 1 second.
All right. Thanks, Zach.
Thank you so much. It's always good to see y'all, and thanks for the time this morning.
So I would get a copy of that, Mary, now?
Jill can get it for you. How about that?
Okay, sweetheart. Thank you very much.
Do it. Okay, did I have another question? I'm sorry. Okay. What do we have next? Oh, well, we're supposed to have committee reports. So the children and youth report is that they haven't met this since May. But they're going to be gearing up. So I attached to this agenda a list of folks who were interested in the committee, participating in whatever committee. So we have children and youth, we have an adult committee, we have a legislative committee, substance abuse services committee, and I believe there's also housing. Is that correct, Jan? Yeah, okay. So if you are interested and you have not signed up or been engaged in any of that committee work, that's really where the work of this group is done. And those committees meet, I guess, virtually right now. But the Children's Committee is going to be meeting probably in September. And then their report will be presented to us. But all of that work, I really want to push folks to say, if you want to get involved in your topic of interest, hello, Mary, then those are the folks that can help you get engaged in that. And we really want to engage as many people as possible and get ideas from all over the state, this region. All right, so Children and Youth is going to meet in September. Is there anything else from Children and Youth Committee? All right, moving on. Adult Committee, Candace, you got anything for us?
Hold on just 1 second. Can you hear me? Okay. No, I do not. Just with vacations and being out and everything, it's just been real difficult to get it scheduled, especially, from my end as well. So I am also, I wanted to say, just looking at the Children's Committee list, that is awesome. For all of us that have been around for several years with Region 2, we could not get anything started with Children's Committee for several years. So that is great to see. And I'm also looking for some other people to help chair, and I put out a couple of, requests out there, and also looking at trying to add some other individuals too from some other counties to represent. So we will be on board for the next meeting as well. Thank you.
Hey, Mary Nell and group. I will also say, Candace, yes, the attendance for the CNY committee has been phenomenal. I will say that we've, Amy's done a great job engaging a variety of providers. I will say that I think the video option has been very helpful for our committee in particular, because we've been able to engage the surrounding regional counties that we weren't able to get present in the past. So just some food for thought moving into future decisions about how some of these meetings can go. It's just been a very valuable tool, I think, for the CNY committee.
I totally agree. I think that's real. The downtime of traveling and to and from, and the danger of it. I used to think about that going back and forth to Nashville. It's like, every single leader is on this road right now, and how dangerous that was, putting all our
it's really hard to ask folks that have an hour plus, travel time from a surrounding county that's part of our region to come attend, in Knoxville. Even if we rotated it, that's just a lot of travel time for an hour, hour and a half, maybe a 2-hour meeting. That just kind of really impacts and impedes certain people's days.
Yes.
So I don't know. It's just some food for thought. It's just, you can see how successful it really has been for our committee.
Yeah, I think it's great. I think it's fun to get together occasionally, but the work can be done in a virtual format and very efficiently. So thanks for that. Okay, so if adults issues or concerns are your interest, then maybe you would like to consider serving on that committee. And legislative, Ben, you got anything for us? You're muted. I know, we've only been doing this for 18 months.
I know, someone's got to do it on every meeting, right?
I know.
So Zach did a excellent report. So thank you, Zach. You took all my good stuff. What I would just suggest is, there's no rest for the weary here, folks. Just because the calendar or the legislative session ended and Zach did a nice report, we get to start thinking about next year too. And so if you really have ideas or concerns about specific issues, now is the time to ask your legislators to come visit your facility, visit with your clients, your staff, tour your property, and try to dig in on some issues. I've tried to steer some folks that are in the private sector regarding huge discrepancies in reimbursement rates that they're experiencing, yet they have the same supervisory requirements as other places, and yet the reimbursement is just wildly different. So those folks are trying to meet with our legislators. Other facilities that provide some alternative treatments are meeting with legislators. So now is the time. If you got an issue you're concerned about, pick up the phone, call the Cordell Hall building phone number for your legislator and say, hey, can I have a Monday coffee meeting or a Friday breakfast meeting or something, and try to walk folks through what the issue is. Legislators want to hear from you, and now they're home.
Right. Thank you. Thanks for that tip there. I think we have Brian Buck with us, unless he just.
Yeah, he's there.
There he is. Okay. Anybody, and Mary's on the line also. So I think we've got a couple of additions to the attendance list. All right. Okay, thank you, Ben. Substance abuse, Jenna Steele Mac. Are you on? Or Courtney?
I am here.
Hello.
And the same as the other committees, we haven't met, but we are looking at our schedules and gonna schedule a meeting either later this month or next month.
Perfect. We did a lot of really good and hard work. And so and then we had the pandemic, it was just that year. So taking time off for the summer, I have no problems with that. And come back and take a look at those needs in the community that are still going on, and regrouping is a good plan. All right, I have posted announcements. I think we're to the announcements and upcoming events part. I've posted the announcements that were sent to me ahead of time. I added a couple. The big thing I wanted to point out is that there is a collaborative effort between Park West Peninsula and Tennessee Suicide Prevention Network. We joined together. We did a virtual support day last year. We're going to do it again this year. It's planned to be in person at Park West. It's the Saturday before Thanksgiving is the national day. So that is this year, November 20th. It's for folks, anyone who has lost a loved one to suicide, to network. It's free. It's open to any of those folks, family members, close friends. If you've lost someone to suicide, there's speakers. There'll be an art activity and some love goodies given out. It's going to be 9 to noon at Park West in the classrooms there. Share that with your colleagues, with folks that you know who have been those who become those survivors. Also, there is a Survivors of Suicide support group. It's called Compass. It is being conducted virtually. It is the second Monday of each month, 6 to 7:30 p.m. It's being held via Zoom. If you're interested, you can reach out to me, or I think there's information on the Peninsula Behavioral Health.org group website. Other announcements. Brian, are you guys doing a bike ride again? You're muted. You're muted. He's number 2, boo.
Can you hear me now? Can you hear me now? Yeah. So actually, we're gonna we're planning on it, depending on what the Delta variant does, having our 5K at the end of October. So get your running shoes out, stretch those hamstrings, and come on out and run with us. That'll be October the 30th, I believe, is the date.
Oh, Halloween, All Saints
Yes.
Day, yeah. All Souls, whatever it is. Any
Day
other
before
announcements?
my daughter's birthday.
Woohoo! Well, then you ought to be running. Other announcements, any other activities? What's going on with NAMI? Ben's got something.
You ready for me?
Yeah.
Okay, so a couple of things. First of all, the 24th Fall Psychiatric Symposium is November 18 to 19. And so faculty has all been recruited. We're in the accreditation and sponsorship phase, and everything should go out the end of the month. Website live, that sort of thing. So if folks are interested in that, it will be a virtual event this year because all of our faculty are from out of town and they've got travel bans placed on them. So it is what it is, and we'll again do it virtually and provide folks with 12 hours of continuing education. The other thing I'll tell you is the state of Tennessee has given us a really nice grant opportunity to promote free mental health screenings across East Tennessee. And we have hired a lady named Janae Cummings, who comes to us with a master's of public health, and she will be managing that program. And what I can tell you about free mental health screenings are that, of course, COVID played a huge role in affecting the mental health of our communities greatly. And we screened 10,712 people last year, and we're already on pace to screen about 12 or 13,000 this year. So maybe the next time I'll bring Janae to this meeting and introduce her directly, okay?
Wonderful.
And
Thank you.
lastly but not least, we are recruiting some peer specialists, and we would hope folks that might be interested would send a resume to me or to call, and I'll put that information in the chat box here. But we hope folks are already CPRS credentialed, and then we can start the ball moving from there, okay?
And that is for positions in the Recovery Call Center.
The Peer Recovery Call Center, yes.
Right.
And this is Chris. I'll go ahead and add a little bit for the 10NAD conference because that's coming up in 2 weeks. We are also going virtual because of the situation. We do have also continuing ed credits available for different professions, and a real emphasis that we're doing this year is family participation. We'd really like to have more families participating in this conference because I think somebody mentioned during the meeting, I can't remember who, you know, it's about the families and the families getting information and getting resources and knowing and connecting with each other. And in the population that this group targets, they don't get together, they isolate. And I'm sure that's the same for a lot of the folks that you work with. People don't want and they can't get out to talk with other families. So we're really trying to get some family involvement with this conference. So the 10NAD website, I'll put that in the chat box as well, but that's tn-nadd.org is the website for that.
I was really impressed because I went to the website, Chris, and I was really impressed that Tennessee is the only state in the U.S. that has a chapter of NAD. That's amazing. That's wonderful.
Yeah, and the national organization is very supportive of that, and they're looking at us as a state to see how they can get other state chapters started.
Yeah.
So, and we're starting committees with families and on public policy to reflect just what's going on in Tennessee versus what's going on in Montana.
Mm-hmm.
Because that doesn't mean as much to families and to people who work here. But what's going on in Tennessee, kind of a lot of what Ben touches on, that's what is important and matters to people.
Yeah, it's awesome. All right, do we have other announcements, other agencies? Or Marcia, there's a note from Ben that your daughter can call the Peer Recovery Call Center for help finding a treatment provider and to get, I guess, signed up for safety net or something like that. I can't read the bottom of that. Oh, there it is. Ongoing peer support.
Could you have it sent to Jill or Cheryl?
Well, yeah, they've got it right there. Yep.
Thank you.
Mm-hmm.
I'll make sure she gets it, Marielle.
Thank you, Jill.
And
All
this is
right.
Chris. I'm missing 2 people who are just calling in. One has a phone number that ends in 09.
Hey, this is Karen. My computer went dead.
Karen.
Broadnax. My computer went dead.
Okay.
Hello, Karen.
All right. And then I also have a phone number that ends in 21.
Hey, good afternoon, everyone. This is Michael Yates. Sorry I was late to the party, but that is I.
Okay.
Thank you.
Hi, Michael.
And Mary, now I'd like to get an application sent from you to get.
Yeah.
I want to be.
We'll get that done. All right. Well, our next meeting is November 10th. Kirby, I don't know if we can continue to meet virtually. Do we know that?
We're going to reassess. We'll probably talk about it more in September before the October meetings start, just kind of see where we're at.
Okay. All right. Well, anything else from the floor? All right. If not, may I have a motion to adjourn?
Seconded.
Ben and Daniel. All right. Thank you all for being here. Thank you for what you do to serve the members of our community, and especially in behavioral health these days. Everybody stay safe, stay well, and we'll see you later.
Thanks, Marielle.
Thank you, Mary. Now.
Thanks, Marielle.
Thanks, everybody.
Thanks, Jan, Ben.
Thank you,
Daniel.
everyone.
Bye. See everybody.